Good afternoon. The Advisory Commission will come to order, or the Disability Advisory Commission will come to order. So thank you all for coming this afternoon. It's been a joy chairing this committee for the past 2 years. And our first order of business is to elect a new chair, and a vice chair. And then we'll do the roll call first, I guess. After we do the roll call, I'll let you obviously call on us, but then I'll have individuals introduce themselves. How would you, what is easiest for staff? Michael, I can have each member introduce themselves since it's the first meeting of 2024. Okay. All right. Why don't I start with my very far left?
Hi. Thank you, Senator. Good afternoon. My name is Gail Brunk, and I am the Executive Director for Valley Associates for Independent Living, Center for Independent Living located in Harrisonburg, and also the current President for the Virginia Association for Centers for Independent Living. It's great to be with you today.
Great to be with you. Thank you. Go ahead.
Hi, I'm Tom Vandiver from Charlottesville. I'm also an executive director of an independent living center for the last 30 years. And I'm happy to be here.
Good afternoon. I'm Patrick Hope. I'm delegate from the 1st District. We're representing part of Arlington County. This is my 5th year on the Disability Commission, and I'm very pleased to be here.
Hi, Laura Jane Cohen from Fairfax County. My first time being on any commission, so thanks very much. Looking forward to it.
Good afternoon. Ghazala Hashmi representing the 15th Senatorial District, which is City of Richmond and Chesterfield County. And this is my 5th year as well on the Disability Commission. Thank you.
Good afternoon. I'm Barbara Favola, State Senator from Arlington County. My entire Senate district is contained within Arlington. The district number's 40, but I have been on this commission now for, I think, 10 years. And, well, I've been on a long time. And I've enjoyed chairing this body, so thank you for that privilege, colleagues. I'd now like to go to my right and ask Amy to introduce herself.
Hello, I'm Delegate Amy Laufer from House District 55, which is the Charlottesville area. And I've actually been on the commission, I think, for 4 years as a citizen. So I'm really excited to be here now in this new role. Thank you.
Hi, I'm John Tollery, a member of the commission in 2020, and I've had a lot of experience in this field of disability, but I guess I'll let the next person speak.
Good afternoon. I'm Ann Flippin. I am the Executive Director of the Autism Society of Central Virginia and sibling to a 33-year-old young man with autism and newly appointed to the commission.
It's not turning green.
There we go.
Okay, go.
Hello, my name is Connor Cummings. I am proud to be autistic. I work as a coordinator and photographer for Zoom Autism Magazine, and I am a self-advocate for the ARC of Northern Virginia, the Autism Society of Northern Virginia, and the state and national affiliates. Thank you.
Delegate, go ahead and introduce yourself.
Good afternoon. Delegate Philip Scott from Spotsylvania, represent the 63rd House District. It covers Orange and Spotsylvania.
Welcome, everybody. So pleased you can join us, and welcome to those who might be participating in this meeting, if you will, virtually. We are not taking public comment at this meeting, so I should just put that right up front. And this is going to be a transition meeting where we will be electing new leadership for the Disability Commission. So the first order of business would be nominations for the chair of the Virginia Disability Advisory Commission.
Madam Chair,
Yes, Delegate Pope.
it is my privilege to nominate Delegate Amy Loeffler as the chair of the Disability Commission.
Okay, a motion has been made to nominate Amy Loeffler. Is there a second?
Second.
There's a second. And Delegate Hope, would you like to move that motion, that nominations be closed? So moved. Okay. Nominations have been, it's been moved, and I second it, that nominations are closed. All those in favor of closing nominations signify by saying aye. Aye. That's unanimous. All those in favor of electing Delegate Amy Loeffler as the new chair of this commission signify by saying aye.
Aye.
Well, that was a unanimous vote. So I will turn the meeting over to Delegate Loeffler, and then it's the election of the vice chair and the rest of the agenda.
Excellent. Okay. Yes. Okay, the first order of business will be now to do the vice chair. I'm opening up the floor to nominations for vice chair.
Madam Chair.
Senator Hashmi.
Thank you, Madam Chair. I would like to nominate Senator Barbara Favola to be our vice chair for the Virginia Disability Commission.
Is there anybody to second? Second. Okay, that was Delegate Hope.
I move that nominations now be closed.
I second that.
And those in favor of closing the nominations signify by saying aye. Aye. And those in favor of Senator Favola as vice chair signify by saying aye. Aye. Opposed? All right, do you have it unanimously as well?
I am looking forward to working with you, Madam Chair.
Thank you, Madam Vice Chair. And I just want to first say thank you to Senator Favola and her excellent leadership for the many years. And later in the agenda, we're going to have an update on legislative priorities that have passed the General Assembly, and I will say in a very bipartisan manner, and that was due to your leadership. And I really hope that I can have a meeting where we have such a robust legislative update at the end of my tenure. So thank you so much. And as I said, I have been on the commission for 4 years, and I've really enjoyed working with everybody and getting to know everyone, and I'm looking forward to our new members as well. And so I think we'll go on to our next part of our agenda, which is the review of the work plan for 2024. We do not have a PowerPoint for this, but I think Hannah Yates will be giving us, and by the way, you can find this information online as well.
Hi, I'm Hannah Yates. I'm with the Division of Legislative Services, and I just wanted to run through our proposed work plan for the Disability Commission for the 2024 interim. So right now, obviously, we're in the May 30th, 2024 meeting, so we've already had the election of the chair and the vice chair, and currently we're reviewing the work plan. So after I review the work plan, the last item will be the review of legislation from the 2024 session affecting people with disabilities. So moving on to the July 2024 meeting, we'll be focusing on housing, transportation, and voting. And the proposal is to have a presentation from the Virginia Housing Commission, a presentation from the Virginia Association of Counties, presentations from representatives of Jaunt, which is a company that provides door-to-door paratransit services for people with disabilities in Charlottesville and Albemarle County. Then a presentation from representatives of Rev Up Virginia, which is a voting campaign regarding voting rights concerns for people with disabilities. So that'll be the July meeting. Then moving on to September, we're looking at focusing on workforce development. So we're looking at having a presentation from the Department of Aging and Rehabilitative Services, which is DARS, and the Department of Behavioral Health and Developmental Services on the implementation of House Bill 1924, which is a bill from 2023, and the agency's workforce development programs. We're also looking at having a presentation from the Department of Medical Assistance Services, which is DMAS, on the work group created by Senate Bill 59, which is Senator Favola's bill from this past session. And then finally, we're looking at having a presentation from representatives of Project Search, which is a one-year school-to-work program that is a collaboration among DARS, Goodwill Industries, the Carilion Clinic, and Roanoke area school systems. And then our last meeting will be in November 2024, and that will focus on legislation status updates. So at that meeting, the Commission would hopefully be voting on recommendations from the 2024 study year. The Commission would be hearing status updates from the Department of Education on identical bills, which are House Bill 1089 and Senate Bill 220, again from this past session. The Commission will be hearing status updates from the Department of Medical Assistance Services on several pieces of legislation from this past session that impact Medicaid waivers, including identical bills, House Bill 577 and Senate Bill 610, identical bills, House Bill 908 and Senate Bill 676, and identical bills, House Bill 909 and Senate Bill 488. And the Commission will also be hearing status updates from the State Council on Higher Education for Virginia on identical bills, House Bill 509 and Senate Bill 21. I know that was a lot, and again, this is the proposed work plan, so hopefully this will all come to fruition, but this is, hopefully what we're looking at for, the upcoming couple meetings. Does anybody have any questions about what I just ran through?
Senator Favola.
Thank you, Madam Chair. I will just note that this is an outline for our work plan. So within these general categories, topics may be tweaked, topics may be added, some topics actually may be deleted. So I just think that might be an important note for Commission members to know. But we are going to stay within the general headings, the general framework. Madam Chair, another comment. It did come to my attention, I don't know if Mr. Frank is still in the audience, but under the September date, the workforce development, the second bullet, you have a presentation on my bill, which it had to do with the Medicaid work group program, and we're trying to figure out how to make it more robust. That was the purpose of the study. But Mr. Frank is telling me that the department won't have information probably not until November, because the report was due, I want to say November 1st in this bill. So we don't have to make any changes now, but just alerting you that that presentation may have to slide to a later date.
Thank you. Any other comments? Well, I'm really looking forward to delving into these next topics. I feel like our legislative priorities were robust this term, and I think getting into workforce and housing and transportation is an exciting opportunity to expand opportunities for individuals with disabilities. So thank you. And we're moving on to our presentation of the review of the legislation, which I believe we do have slides for, and Ms. Hannah Yates will be sharing.
Madam Chair, did you want the work plan adopted?
Oh, sorry.
Okay.
Yes.
I will move that we adopt the proposed work plan for the 2024 study year.
Second.
Okay, now that it's been properly moved and seconded, is there any discussion? Okay, and if all in favor of the work plan as shown, please say yes or aye.
Aye.
Aye. Anyone opposed? Okay, moved unanimously again. Thank you. All right, Ms. Yates.
So I'm going to briefly go over the legislation of interest from this past session, legislation that affects people with disabilities. So something to note as we're going through the PowerPoint, if you look at the bottom of the screen, there are asterisks that tell you which portions of the PowerPoint relate to which bill. I thought that would be easier to read as opposed to putting all the text together. So if you're like, oh, I want to read more about that bill, you can look down at the bottom of the screen and see which bill each section relates to. So first, these are the bills that affected Medicaid and Medicaid waivers. So the Department of Medical Assistance Services has been directed to do a number of things, including evaluating the possibility of allowing respite services under certain Medicaid waivers, amending the financial eligibility standards for individuals receiving services under developmental disability waivers by disregarding any Social Security disability insurance above the maximum supplemental security income, and convening a work group of relevant stakeholders to study and make recommendations to improve the federal Medicaid Works program. So the Department of Medical Assistance Services and the Department of Behavioral Health and Developmental Services have been directed to amend regulations to allow support coordinators to request and obtain approval of consecutive waiver slot retention requests for a period of up to 365 days for individuals with a developmental disability waiver slot. So currently, I believe the standard is they can request up to 4 waiver retention slots for 30 days each. So this expands it quite a lot. And they have also been directed to seek authority to modify the program rules for certain Medicaid waivers to allow legally responsible individuals to, for those with more than one waiver receiving child, receive reimbursement for up to 40 hours of work per week per child receiving a waiver, receive reimbursement for personal care services, regardless of the availability of another person to provide services, and be the employer of record. So moving on to education. So the State Council of Higher Education for Virginia has been directed to study each college and university in the Commonwealth's process for determining student eligibility for disability accommodations, identify any barriers to students establishing such eligibility, and make recommendations on reducing such barriers and on the development and establishment of a uniform accommodations eligibility determination. The Department for Aging and Rehabilitative Services has been directed to ensure that online resources are available and disseminated to all individuals of age to transition from school to post-school activities and their families. So the Department of Education has been directed to develop and make available to each local school board an individualized education program, IEP, writing, facilitation, tracking, and transfer system that includes, at a minimum, an IEP template component and a data system component, and develop and publish a data dashboard for public reporting of special education data. And each local school board has been directed to designate a faculty member to serve as a special education parent-family liaison for the referral, evaluation, reevaluation, eligibility, and IEP process. The Parent Training and Information Center has been directed to establish special education family support centers throughout the Commonwealth, coordinate with the special education parent-family liaisons, and conduct outreach to parents of children with disabilities, and track and report to the State Parent Ombudsman for special education data on questions and concerns raised by parents. And now the State Parent Ombudsman for special education, that is a neutral party who advocates for fair process and provides confidential, informal assistance and support to parents, guardians, advocates, educators, and students with disabilities. And they also serve as a source of information, referral, and support to parents in non-legal special education matters. So now we're moving on to kind of miscellaneous topics that didn't fit into those broader categories that we just discussed. So first we have a couple of changes to election laws. So the definition of person with disability has been amended in Title 24.2. So it's been expanded from physical disability to just disability. So the legislation, if you look at the bill, it just removes the word physical. So it expands it quite a bit. Any qualified voter who is a person with a disability is eligible for assistance outside of the polling place. And the training for election officers is required to include training on voting outside of the polling place, and the Department of Elections has been directed to include the processes for voting outside of the polling place into guidance documents. And then for the purpose of civil commitments and temporary detention orders, behaviors and symptoms that manifest from a neurocognitive disorder or a neurodevelopmental disability are excluded from the definition of mental illness. And more miscellaneous legislation. So for the purpose of determining whether a quorum of a public body is assembled, a member of a public body who is a person with a disability or a caregiver and uses remote participation counts towards the quorum as if the individual was physically present. And the Department of Motor Vehicles has been directed to extend from 6 months to 12 months the duration for which a temporary removable windshield placard may be issued to a person with a disability, limiting or impairing his ability to walk, and the fee for the issuance of temporary and permanent disabled parking placards has been eliminated. The Department of Criminal Justice Services has been directed to establish training standards for law enforcement officers on communicating with individuals with an intellectual or developmental disability. And that training will be, they've been directed to establish the training by January 2027, and then officers, I believe, who were sworn in by a certain date in 2024, before that date, are required to complete the training by July 1st, 2028. Okay, that was my last slide. I know that was a lot of information all at once. Does anybody have any questions?
Anybody on the commission? Oh, yes.
Madam Chair. Hi, Hannah. Thank you so much for your presentation. I just wanted to, on behalf of Centers for Independent Living, offer up some opportunities that we would be happy to help as we look at some of these. Centers for Independent Living were very critical in the creation of the Medicaid buy-in and the Medicaid Works programs. And so we would be very happy to help with that work group. And looking also at the higher education, also want to put out there that as Centers for Independent Living that employ individuals with disabilities and serve individuals across disability, we have many that have gone to higher education and had the experience of asking for accommodations. So I just want to put the plug out there that we're happy to, but just to also ensure that people that have had the experience are certainly part of that group. And then my final one was on, just wanted to offer up that a couple times Centers for Independent Living have had the contract with the State Board of Elections to do the polling site accessibility survey. So if there's any assistance needed with additional training, we would be happy to help.
Awesome. Thank you very much. Anybody else? I just want to say this was an amazing amount. I think I'm really proud of the General Assembly for taking on these issues. And I'm really excited for the Center for Independence to be helping guide this discussion. And if there is anything else, yes, Senator Favola.
Thank you, Madam Chair. I just want to note part of the success that our commission enjoyed this past year, these past 2 years actually, has been in part the result of our ability to coordinate with other commissions that have had work that intersect with what we're doing. The Commission on Youth, for example, gave a presentation on recommendations that resulted from studies they had done, and we were very amenable to adopting those recommendations. So, and I know under your leadership, we will continue to collaborate with groups that will have an intersection with the constituencies we serve. So, and I know Senator Hashmi is the chair of Education and Health, and I chair the Health Subcommittee on that group, and we will, in fact, have some areas where we intersect with our disability constituencies, and I just want to make sure we continue that collaborative effort. Thank you.
Anyone else? I feel it. Yes.
Thank you, Madam Chair. Just a few comments. I'd like to echo the Senator's statements about collaborating with other commissions and boards. I know that there's the Rare Disease Council, and I think they would be able to provide a wealth of information and guidance for us on how to better serve the Commonwealth. Also, I had a piece of legislation that did not make it through because there were some issues with the way it was written this past year that I actually had it pulled, but it addressed the standard of learning assessments, specifically for children with IEPs. And I think that's something that our work group would be good. It would be good for us to kind of work down that path. My office had a meeting with a constituent just yesterday dealing with that topic, and he is actually taking up that mantle and wanting to move forward. And so having that meeting yesterday and then here today and talking about IEPs and the education element, I think that it would be wise of us to kind of follow through on that to see what we can do for next year. From the meeting yesterday, it seems like there's going to be a big chunk of money up front to get a system in place, but then it's going to be available year after year after year with minimal. And so want to bring that to the attention of the body here.
Thank you. I know that I believe that we're going to try to have a work group about the, it was a large bill that was passed for IEP. And would you like to talk about that, Senator Vogel?
No, I was just going to say that may dovetail very well, very nicely, I guess, with the bill that Delegate Coiner carried and I carried on the special education reform. We didn't get to the standards of learning, but it's incorporated. Yeah. Madam Chair, I have another topic I just wanted to bring up to see maybe what the status is.
Sure.
I believe this last year correct me if I'm wrong, staff, I think we put language perhaps in the budget on rejuvenating the Autism Council. And I was just asked when that council is going to meet, if there's a schedule, so I would like to have some information to relay to this constituent.
Sure, Madam Chair. Julia Carlton with the Division of Legislative Services. I'm going to be one of the staff people for the Autism Advisory Council. Technically, that council doesn't take effect until July 1st, and we're also waiting for, I think, about 12 governor's appointments. So I would anticipate after July, pretty soon after July 1st, getting a schedule together in a first meeting.
I would expect if members of this commission have suggested appointees or appointees they would like the governor to consider, there's a process for doing that. So you may want to consider that opportunity.
Could staff send us that information on how to suggest members? Is that possible? Yep.
Madam Chair, sure, I can look into that. I'm not super familiar with that process, but we'll figure that out.
That would be wonderful.
I think you have to go online and create a recommendation and submit that recommendation. But
can you turn your mic on?
But I'm sure that maybe if we had somebody who was willing to offer an endorsement on a individual who he or she thinks might be a good appointee to that council, it might be viewed positively.
Right.
But I endorse your suggestion for informing the staff on how we could possibly influence the appointments.
So that is that you will send us the information and then we can disseminate to everyone on the commission. Okay, wonderful. Is there any other suggestions? I'm totally interested in collaborating because I think this is the only way to actually move forward. So thank you very much for these suggestions. And I think we actually are at the end of our agenda, which is a very quick meeting, unless anybody had any other business. Yes. Sure. Connor.
Okay. Madam Chair, can we request a possible study on the following? Virginia has had a waiting, first of all, Virginia has had a waiting list of many thousands of people waiting for DD waivers for more than 20 years. See, the General Assembly just passed a budget to get help to 3,400 people on that list, but at least 12,000 people still waiting for help. But we do know that the 12,000 people on that list still aren't in crisis just yet. Just a little help, like a caregiver to come a few hours each week, a case manager to help them find services, and some respite for their family can keep them out of crisis and help families stay working. We would like to see a study of what it would look like and cost to pursue this idea of the offering core service to people on the waiting list. The General Assembly loosely looked at this years ago and recommended the idea, but it hasn't gone anywhere. It would be a stronger bill with data and export input. So there.
Thank you, Connor. We did actually approve money towards the waiver program, and we'll be releasing, Category 1, we'll be releasing spots quarterly. Okay, I'm sorry.
Yes, because that's why it was saying that with the crisis fund, that being eliminated too, in order for the.
Oh, could you, only for the list?
Okay, in order for the others not to get into crisis, to give them some sort of little core help. And so to get like a study for that, he can send this into you if you want. So maybe
Yes,
it's a
please.
possibility
Yeah,
looking
that
into
would
it.
be wonderful, and then I'll disseminate to everyone as well.
Okay, thank you.
I'm sorry, could you say that again, Senator? I know it's my first time, so.
Just going to, Madam Chair, I mean, part of the issue with the relieving that wait list, which is very large for the last two categories, has not only been money, it's been finding providers, building the capacity. So it's a really multifaceted issue. And I guess, Madam Chair, we probably will need a full briefing on that from DMAS at some point.
Yes, Delegate Hope.
I would say if we can build on that, I mean, we're putting 3,500 waivers online starting July 1st, and they're going to come out in quarterly. And so I think it might be good for this commission to take a look at that and see how that's going and monitor, because to your point, Senator Favola, do we have enough providers? They're going to be releasing these out in tranches quarterly until we get to that point. But I do think that we need to better understand the providers that are in this space, what's the quality of care of those providers, and of course, are we reimbursing? Are we paying them enough? And so I think this commission is a good place to monitor how that rollout is working.
Right, and we will have an update actually in November with Senator Favola. Did you have something else?
No.
Oh.
Unless we feel we need an update sooner, but I'm fine, Madam Chair.
Okay, a lot of work to do.
Madam Chair?
Yes.
I'm wondering if, in addition to what Delegate Hope was stating about looking at the provider network, if when that presentation comes, if there's an opportunity to look at not just how many providers, but where the providers are located. Is that, sorry, I was not eavesdropping. I just know in our locality, you get the waiver and you're very excited and we hand you 6 pages of services and we have 2. So I think that might also be very helpful to look at the whole Commonwealth and where our providers are currently at and where provider network development needs to happen.
Okay.
Thank you.
Actually, I'm just wondering, would staff be working on that? Or is this are we proposing a JLAC study?
Madam Chair, I believe since we've put the money in for the slots, and we did put additional dollars in to increase the reimbursement to providers, I think they were interested in trying to get those slots allocated and filled. So I guess I would start with the department and to see exactly what they're doing as we directed them in the budget. So why don't we get an update first before we
I think
decide if we need an additional study.
Right. You know, I will say that I chose November just to allow all the agencies to be able to work on the things that we've passed, because sometimes we're asking so much and it's a lot to do. And if we're constantly asking for updates, they don't have time to actually do the work. So I want to be mindful that this was a lot, 3,500 quarterly, is obviously not the ending point. It's just the beginning. So, you know, yeah, I think having November be the time will hopefully have given them, you know, at least a handful of months to implement. So, is there any other? Okay, well, I can't believe that it was that quick. And I just want to say again how grateful I am to my colleagues. And I'm very excited to do this. And I'm excited about this work plan as well. So thank you very much. And without any other comments?
Madam Chair, I move that we adjourn.
Second.
All in favor?
Aye.
This is over.
Congratulations. The Senate of Virginia, Richmond, Virginia.